Welcome back to another episode of Health Bites from our specialists. The topic we're tackling today is dementia. I'm Genevieve and joining me is Dr. Alvin.
Hi, I'm Alvin from the Department of Geriatric Medicine in SKH.
With World Alzheimer's Day approaching this month, this seems like the perfect time to ask the big question. Dementia and Alzheimer's disease. Are we talking about the same condition?
Dementia is a condition where affected individuals experience deficits in their cognitive function. This can include impairment in memory, their ability to reason, or their ability to speak or understand what is spoken. Whereas Alzheimer's disease is a chronic degenerative disease of the brain, where there is progressive brain damage that occurs over time, and this can lead to the development of dementia. However, patients with Alzheimer's disease do not necessarily have dementia at the point in time. So for example, your loved ones may sometimes mention to you that they're forgetting things here and there. Such forgetfulness can be occasional, which can be normal, but in patients with dementia, this forgetfulness becomes increasingly persistent and frequent and will interfere with their daily lives. For example, a person may frequently forget their medical appointments even with reminders and memory aids, whereas somebody with only occasional forgetfulness can easily recall their appointments with simple reminders. Also, a person who drives and who develops dementia may find themselves forgetting their commonly taken routes and get frequently lost and miss their directions when driving. A lifelong housewife who frequently cooks for their family may find themselves having difficulty remembering their recipes, and their families may also complain that their cooking has taken on a different taste or actually tastes bad.
So it seems like the key is a real change in their daily life. It's not just occasional forgetfulness. So given how serious this sounds, is there anything we can do to actually reduce our risk of developing Alzheimer's or other forms of dementia?
Well, there's no guaranteed way to prevent ourselves from getting dementia, but we can do what we can to reduce our risk. Maintain physical and mental well-being. Getting regular physical exercise, for example, improves our heart health and also promotes mental well-being. Keeping our mind active by playing games, engaging in new hobbies, and reading will also help towards preventing or reducing your risk of dementia. Yes, chronic stress and depression are linked with development of all forms of dementia. So if you or your loved ones have issues with managing stress or mental health, you should try to seek help. A good support network will help towards better managing stress and mental health. Our Health Buddy app has a senior wellness module where our elderly can access resources on self-evaluation of mental health and stress coping.
I'm glad that they're so easily accessible on Health Buddy app. Now, if families do notice these concerning changes, from their loved ones after using the self-help tools, what's the next step? Where should they go to seek proper professional help?
So if there is concern that one of their elderly relatives is experiencing symptoms suspicious of dementia or depression, the first step would be to go to your trusted family practitioner or polyclinic doctor to get an initial evaluation. Once the assessment is done and the doctor deems it appropriate, they can refer to one of our clinics in geriatric medicine, where one of the geriatricians, such as myself, will perform a comprehensive geriatric assessment. This includes detailed history about the cognitive impairment, a thorough physical examination, and cognitive tests. We will also usually order some blood tests as well as arrange for brain scans.
As we wrap this topic up, what is the most important thing you feel that people should understand about dementia?
In our rapidly aging Singapore society, dementia will become more and more commonplace, and more of us will have to deal with dementia indirectly through one of our relatives or perhaps even ourselves in future. With good preparation, we as a society should be able to cope with the challenges ahead.
Thank you so much, Dr. Alvin, for enlightening us about the topic of Alzheimer's disease and dementia.
Thank you.
That's all for today's Health Bites from our specialists. We'll see you next time. Bye!